Good morning and good afternoon, everyone here. My name is Ahmed Al-Bastaki, and I'll be chairing this panel. First of all, I would like to introduce myself. As I said, my name is Ahmed Al-Bastaki, and I have more than 28 years experience in healthcare and supply chain across United Arab Emirates and also across other countries from, say, India and Morocco. So I've been traveling around, and that's my experience from. Recently, now I'm the chief of strategy at Rafid. Rafid is a group purchasing organization, one of the first in the region. And we are responsible for securing of medical consumables, pharmaceuticals, medical equipment to the healthcare facilities. And also we are currently started to be one of the key members at Hope Consortium that's responsible for delivering and supplying the vaccines, not only just on UAE, that's one thing, and also we crossed with that to other countries in the region. Today, we supplied more than 200 million vaccines to 60 countries around the world. So that's about Rafid and what we do. And just today, I'm glad to have you all at this panel, which is about legal and regulatory. So before we proceed, I would go through every member here to introduce yourselves. So let's, I think always ladies first. So Christina, if you would begin to introduce yourself.
Certainly. Thank you very much. My name is Christina Reineker. I'm the Chief Operating Officer for SAPRA. I joined the organization in January this year. And prior to joining the regulator, I was in the logistics industry. We were mainly focused on warehousing and distribution of pharmaceutical goods within South Africa and then also to our neighboring countries. So a little bit more of a logistics and a warehousing background. And I think certainly looking forward to the discussion and also using this as a bit of a learning experience. So thank you very much for the opportunity.
Thank you so much. Mr. Abe, I think you also, would you introduce yourself?
Of course, thank you very much. Good afternoon, good morning, everyone. My name is abbom. I'm representing TAPA EMEA. TAPA stands for Transported Asset Protection Association. Our association is related to the complete supply chain, also for pharmaceuticals. We have around 37 of the main names in the pharmaceutical world connected to our association. Before I joined the association in my present role of Chief Financial and Compliance Officer, I worked for 20 years in the logistics industry with DHL Express and later on with Amazon. So yeah, a huge experience in the logistics sector and also connected to pharmaceutical clients, so to say. And yeah, looking forward to have a very fruitful panel.
Thank you. Mr. Nanofa?
Yes, thanks for having me. My name is Nanofa Tipe. I come from the Botswana Medicines Regulatory Authority in Botswana. There I serve as the legal and corporate secretary, so I assist with both board affairs as well as the legal developments there. My background has always been in regulation, having started with the financial sector, regulating non-bank financial institutions, that is your insurers, pension funds, those sorts of entities, before I moved on to medicines regulation. So the authority is quite young, having been established formally in 2018. We're on our first strategy, and as an ambitious target, we're trying to reach maturity level 3 based on the global benchmarking tool. So it's a pleasure to be here. I'm sure I'll learn a lot. Quite young in the industry, but I have done some exploring. Thank you.
Pleasure is ours. Mr. Dion.
Good afternoon. Yeah, my name is Dion Proven. I'm the Senior Manager for Inspected and Regulatory Compliance at SAPRA, looking after the inspected, our law enforcement colleagues, as well as licensing. I've joined SAPRA coming from the industry. I've worked in production as well as quality assurance and did a little bit of distribution activities for clinical trials. So thank you very much for having me.
Thank you. Pleasure to have you all here. And just if you are this session, this panel is about the regularity and legal and regulatory frameworks. So this session will look at the role that local regulatory authorities and bodies play to streamline regulatory processes. So what we will request from the panelists here, that on what we will discuss is how to ensure the quality, the safety, and affordable medical products, and traceability and assurance that through the supply chain in local Africa, and also how to avoid the complexities such as counterfeiting, product damage, and temperature control, which is the most important subject is today. So let me begin with the questions or the discussions panel here. So we would like to Mr. App here. The question is more, I would like to, if you take us through the importance of standards in vaccine and logistics value chain.
Yeah, thank you very much, and good question. So when we started TAPA in 1997 all over the world, so we have sister organizations who are not only working in EMEA, also working in the APAC region and in the America region, we decided to directly develop standards for our members, because standards in itself helps to standardize the whole supply chain, which is in the end very important related to pharmaceutical products. So we have 3 actual standards. One of them is the freight security requirements, in which we define the standards for protecting a warehouse. We have the parking security requirements for goods on the road, and we have the truck security requirements. And the reason why we all have this is that we think that industry standards helps tremendously to, let's say, bring down the problem of attacks on our supply chain. Especially related to pharmaceutical, where the integrity of the product is very important, their standards play an important role. And of course, when we have the standards, it's also very obvious if we show this to the regulatory bodies, like the European Commission, the World Customs Organization, Interpol, Europol, EUMI, United Nations. On that level, we bring further the importance of the standards for our members, under which the pharmaceutical members. And we believe when we can standardize the whole value chain of logistics, which is this in itself for the pharmaceutical industry, this helps the industry tremendously to tackle all the issues related to not only cargo theft, but especially with pharmaceuticals, the integrity of the product.
Mr. Nanofa, I mean, if you can shed a light for us to hear on the avenues for progressing and harmonization in light of varied legal structures.
Yes, thank you. I think as a regulator particularly, we'd be aware that legislation is the foundation of most of the things that we do in terms of providing a framework, as well as a mandate and job powers. And it can very quickly devolve if those powers are not in line with what you seek to achieve. So in terms of regulation, you are affecting people's rights. In the case of medicines, you're usually affecting producers, manufacturing markets. So the manner in which you craft this law is quite important. The challenge for us in Africa particularly, and within our region, is that the laws are not aligned. And from where these laws are derived historically, as well as the cultural and political landscape, may affect how our law is progressed, which can be hampering to harmonization. Now, the benefits of harmonization are clear in terms of operational efficiency. If laws are aligned, we should be able to reach a point where it is actually now affordable to get medicines, but from the regulator's perspective, always keeping in sight the safety and efficacy. If in the absence of law or legislation that is aligned, we have to then focus maybe on other areas which we can affect. And for our purposes in Africa, it's usually a case of resourcing as well as understanding of what is required. And so I think greater emphasis needs to be placed on collaboration, even at regulatory level, to spread knowledge and information apart from the legislative frameworks. In this way, we will be solving the problem, at least from a thinking perspective, so that by the time the laws catch up, we are all aligned, and this may actually push us towards an understanding of how to achieve the benefits of harmonization in future. I think that is one of the ways we can achieve that.
Yeah, we wish you really good luck on that. We understand that how difficult it is always to align all the governmental bodies on the same to begin to finalize this harmonization process and requirements. My question here also again is to Dion. It is about I would say about if you can take us through the licensing and inspection framework for local production, how it is, and maybe the same question also, I will take it then after that to Christina again. Maybe we can see it from different points of views. That will be also very good.
Thank you so much. So yes, in terms of the topic which talks about, you know, your quality, your safety, affordable products, and the question around local production. I mean, you know, as an example for South Africa, we're quite dependent on what comes in as importing. So what is it that we as the regulator are doing to make sure that we can enable local production? And as the regulator, those things come down to licensing. It comes down to our inspection framework, and then talking to what Mr. Nanofa said, reliance on different what other countries are doing and collaborations in those sort of areas. So just an example, in South Africa, we do licensing of manufacturing facilities, and then we grant those licenses based on inspection according to good practices. And especially for manufacturing, we're talking about good manufacturing practice. So it's important for countries to be able to support the industry in this, because it is not just about your local production. Licensing in South Africa also applies to your export product. So it's not just for product that we do here in South Africa. We need to be able to, as a country, from country to country, be able to give some sort of surety or assurance that what we are producing locally is not going to affect the country that we are exporting to. And in that way, not only collaborating in terms of regulatory frameworks, but also collaborating in terms of supply and into those countries. Thank you.
Thank you. Christina, I think if we transfer the same question from your point of view on this subject, again, the licensing and the inspection frameworks.
Thank you very much. I think I echo what Dion is saying, but I think it also ties in very much with what the colleague from BOMRA mentioned in terms of just progressing harmonization, you know, across varied legal structures, and how it has just become more and more important for us from, I think, a collaboration perspective, to work with other regulatory authorities within the African content and context around making sure that the licensing and the inspection frameworks that we have in place is in fact such that it does enable us to use the practice of reliance more freely across all of the various NRAs on the continent. And I think it also helps us address, you know, I think within a supply chain, we talk about resource constraints. It is the same in the regulatory environment as well. So as regulators, we want to work more closely with each other And specifically, I think if we have this progressive frameworks put in place where we have single standards or single approaches, it makes it a lot easier to leverage off the work done by one regulator in another regulatory environment. But very important, I think, to provide that reassurance to everyone in the continent for the different regulatory environments that whatever product is produced in a country within the African context, that those are safe, efficacious, and of good quality. So very important, I think, that we continue to collaborate in that respect. Thank you very much.
Thank you. Just one question extra on this subject again, if anybody can answer that. In case of we have several level of, for example, if you're talking about the vaccines, we have can it start from packing, from fill and finish, or full production? So does the laws and the framework across this line, how does it change when applying different level of production? So does the inspection level will start to increase, or is it the same across the whole process?
I'm going to tag in my colleague Dion to talk to that. He's the expert in this topic. So if I may, Dion.
Thank you. And it all depends on what it is that you are applying to do. You know, licenses are given in terms of the activities that you are approved or that you have applied for and what the regulator will approve you for. So if you are doing, you have a facility and you want just to fill and finish, you know, we are not going to give you a license to do drug substance production. Whereas if you apply to do the whole downstream process of your biological product as well as the upstream, that will be part of your application. And that is what we will inspect you against. And one thing that I also wanted to add that I didn't add in previously is that we also, as the regulator, need to enable the industry to distribute these products under a controlled manner. And the regulator plays a very good, very important aspect there as well, because we also license in South Africa the warehouses and the supply chain in terms of cold chain. So that's also a very important aspect, especially when it comes to logistics, that we make sure that when the product gets to the end user, whether it be the healthcare professional that is administering that, or whether it be just another pharmacy that somebody's going to be purchasing from, we make sure that that supply chain is covered, making sure that when the product gets there, that it is what it's supposed to be and it does what it is supposed to do. Thank you.
Thank you so much. My next is point of we would like to shed light on is more with Mr. Boom is does it look like the process of incident reporting as part of a traceable and assurance system? So how does it work?
Yeah, one of the added values of TAPA that we provide to our members, but also to authorities and regulatory bodies, is our daily life incident intelligence system. So we're gathering all of the supply chain incident data all over the world, not only from our members, but also from LEA, from law enforcement agencies, from governmental bodies. And of course, with respect to this presentation, we took a summary out of it to the pharmaceuticals. And then for the last years, you see that we count at least 12 main incidents in the pharmaceutical industry where the supply chain was disturbed. Such an incident intelligence base is not only to register the incidents, because that would be far too easy. The reason why we register the incidents and the MOs of the perpetrators, the modus operandi, is that we want to know how the supply chain, especially with regards to certain sectors like pharmaceuticals, but also high-tech companies, how this is disturbing, let's say, the value supply chain they have in place. And what we take out of the incident system is that we can feed the regulatory bodies with what's let's say, trending topics in the world of criminality, but also to give learning points to our members. And as already said, we have in EMEA 38 of the main players in the pharmaceutical industry connected to our association. we send it out as a kind of learning process to show what the incidents are telling us and how the incidents can be prevented. So that in the end, all you want to prevent, especially with regards to pharmaceuticals, is that you don't see incident on adding security costs, the loss of sales, how you communicate with the affected parties, sometimes very high insurance costs, of course, that's what we see. But there is also an outreach to client. You can imagine if there is a specific pharmaceutical issue which disappears in the supply chain network, that can be very costly to replace it, if it's even possible to replace it, if you talk about very high level extended medicines. And of course, there is the reputational damage for our peers and our members, which sometimes leads to share price damage. So bringing all this information together in our incident information system helps the world of supply chain, and in this specific, the pharmaceutical supply chain, to have a view what's going on in the world and how to prevent this, and how we can support them towards the regulatory bodies to be sure that the right products is in the right chain.
Thank you so much for that. Mr. Nanofa, from your point of view, what are the rules and opportunities for regulators in driving harmonization? So that's which will lead to effective regulations and market facilitation.
Yes, the regulator is in a peculiar position, which is actually a position of power in certain ways. We are central in terms of understanding the needs of various stakeholders. From the production perspective, we need to engage and understand how to facilitate our partners in that area. From the legislative perspective, we need to motivate for the right sort of legislation as well, and to make sure that it's aligned to the needs of our production partners, the regulator itself, and the public. The balancing act, essentially. So as a regulator, these hats that you wear, I think at all times you need to have a focal point, being that we want safe medicines that are efficacious and of the right quality. And we want a scientific basis for this, achieving this. You find that sometimes we get waylaid by other issues that are not necessarily going to drive us to that point. So the regulator has to wear those different hats and lead and guide the process such that we are always moving in the right direction. That is, I think, one of the ways in which we can achieve progress in this area and drive it from the regulator's perspective.
Thank you so much. Thank you. Christina and Dion, I think one word everybody here, we start to hear it a lot, other than we say always you are on mute, is that the emergency use. We heard it a lot recently and it's kept repeating a lot. And so what is the process of product registration, and especially for emergency use authorization? How it gets and what is the process in this situation?
So I think I'll kick off and then hand off to Dion. I think just from my perspective, coming more from the operations office side, one thing, and certainly as you've noted, it's a term that we've become so familiar with, this thing around emergency use. And for the organization, in terms of the regulator having set processes and set practices, I think even just being confronted with COVID-19 and what SAPRA in particular had to go through to very quickly scale up or adapt its processes and its practices to then meet this requirement for expedited reviews and much more efficient turnaround of answers or feedback to the industry has, I think, been a very interesting challenge. And certainly for the organization, it also has catalyzed, I think, certain digital transformation efforts where we see ourselves now moving and operating in a much different way than we were before. So I think looking at not the technical and regulatory aspects, but more from an operational aspect, how each of the regulators, I think, I suppose globally, were confronted with finding new ways of working very quickly. Also, being mindful of the fact that we operate in a very defined framework, and we couldn't all of a sudden just chuck the rule book out of the window and just do things in a new way. So it was really challenging the colleagues to find an innovative way to operate within our frameworks, but then to do things just a lot more efficiently and a lot more quickly. And I suppose talking to the colleague from Bonra's point in terms of just wearing these different caps, that is something I think we will have as an ongoing challenge for all regulators on the continent, I suppose even globally, in terms of how do we adapt wearing these different hats in this context, making sure that we can facilitate product registration for emergency use in pandemic situations. I certainly am not a conspiracy theorist, but certainly I think we haven't seen the last of these flare-ups or these interesting phenomenon that we've now experienced with COVID-19. Yeah. So it is something I think that definitely as a regulator, you've got to learn now to think on your feet and be quick to be able to adapt to these changes. Certainly COVID has taught us that. Thank you.
Exactly. Thank you so much. Maybe Dion, if you had an add on that.
Yeah, I'd like to add on that and just, echo what Christina has said. I mean, if you think of regulators having this us and them approach, we couldn't do that. We couldn't leave, the industry. We couldn't leave the people of our countries to just fend for themselves. We had to, get into a room with people and we had to say, okay, you're bringing in vaccines that have to be stored at -70. Have you considered that you have these facilities? Have we asked these questions? Have we as the regulator asked the industry, can you handle this? Before we step in and say, you don't have this, we had to ask them, do you have this? We need to come in there and we need to make sure that you are operating properly. So it was a very collaborative, we couldn't step back. And I think that was one of the lessons learned when it came to this emergency use authorizations, is that, like Christina said, we couldn't throw the rule book out, but we couldn't leave the industry to fend for themselves as well. And I think that was the great sort of lesson that we've learned, is that there is no us in them, it's us. And yeah, so thank you.
Thank you. Maybe I will have one final question that's open for anybody here. You can raise your hand and you can answer it. Is the most critical subject is of course, getting the vaccine done was the next step, was how you move it, where you save it. That was the next challenge. But also another challenge is that for the fraud and for the substandards or falsified products, what is the mechanism and to prevent these kind of products to reach to the final user and to the end user here? It's open question for anybody. You can raise your hand. You can answer if you are anytime.
I think maybe I'll comment just reflecting on what the colleague from TAPA raised earlier around how important it is that we properly manage the reporting around incidents. As I've mentioned, coming from the logistics industry previously, we also belong to TAPA and were TAPA certified. And certainly, I think the collaboration that you get in such a work stream on how can I say, organization being part of that structure, I think should provide reassurance to the parties that actually then deal with you or contract with you or do business with you. Because the mechanisms by virtue of being TAPA certified that you then provide in for instance, just the warehousing and distribution component that I'm talking to is something that provides that reassurance that, you know, product that is in, for instance, this warehouse and being distributed in this specific part of the supply chain, you have confidence that the right security measures is in place, and that if there is an incident, it is something that will be communicated transparently, and there will be very swift action taken to mitigate any risk that it may hold for the public. And this is really very important. I think it's, again, as Dion says, that collaboration is tantamount to the success of stamping out counterfeits, and the opportunities that you know, I think, you know, operating in a supply chain that doesn't have that level of transparency, it creates unnecessary opportunities for people to exploit those little shadows and those little dark corners. Because if you operate where your reporting is available, where you collaborate with organizations and other regulatory authorities, it very, very soon closes that gap and makes available only an approved supply chain, which is really where we feel, you know, our products that move through an approved supply chain, it has the right controls. It's been inspected by Dion and his colleagues, and they've given reassurance to the public that this warehouse or this manufacturing site, it's an approved and it meets the right standards. So I think just being part of those kind of organizations and having that level of collaboration greatly contributes to the approach, I think, from all parties that are involved with, fraud prevention and detection of substandard medicines, to be able to do a good job and make sure that products that do reach our patients are actually of sound quality and they are safe.
Yeah.
Thank you.
And thank you so much. Mr. Boom, I saw you also, like, you were about to talk.
Yeah, first of all, Christina, thanks for this. It's fantastic to hear somebody on your level, you know, echoing the importance of the TAPA Association. Yeah, if we can drive this to a conclusion, you know, of course, we know from our members that they have a very integral and very transparent production method and processes, which is in the hand of the regulators to follow that. Actually, where my annoyance with this business is of course, when it enters the supply chain. And there you see our conclusion is that the pharmaceutical industry is well aware of the threat to the supply chain and the broad consequences of product losses. I don't think we have to convince the pharmaceutical industry on that. But as said, and I have to echo here a bit, that a resilient supply chain needs a demand of 24/7, 365 focus. And as already said, but I will repeat this gladly, is that the TAPA's pharma industry members, they proactively encourage their logistic partners to meet our industry standards. So it's the first thing is, the first step is that the pharmaceutical apologies, producers see the need for a secure supply chain, but then they have to stimulate their logistic service providers to also be part of that secure supply chain. And that's what we saw as a trend already far before COVID-19, but you can imagine that once we started to discuss the whole COVID-19 distribution, vaccines distribution, that we saw a huge growth in members of TAPA and certifications in TAPA, because all the logistic service providers were forced by their buyers, so the pharmaceutical industry, to be a member of TAPA. But let's not forget, and this is not, you know, to do something about mirroring or whatever, but you know, we count over 5,000 organized crime groups of 180 nationalities out of this incident system we have in cooperation with everybody connected to that incident system. And let's not forget the inside job danger, yeah? Especially in the production, but also in the supply chain. Where's money? There are people involved. People are not always, let's say, earn the money they think they need to earn. So inside job is also a very important part of our preventive measure. And let's hope that the next big pharma theft is not just around the corner, but that we are able to prevent that.
Great. Thank you so much. Thank
You're
you so much. This concludes the session. Thank you all. This was really a very informative panel discussion, and I believe we can add much value as we collaborate together in our respective role throughout the values, supply chain, and logistics industry. And I'll hopefully we'll see you all again in future, and stay safe.
Thank you very much.
Thank you.
Thank you very much. Thank you.